COVID-19 quickly spread around the world because of how easily it can be transmitted. The Centers for Disease Control and Prevention say wearing a mask can help slow the spread of COVID-19 to others. Dr. Manav Sidhu is an emergency medicine physician at Community Regional Medical Center. He shows us how quickly germs can spread and highlights the extreme importance in wearing a face covering.
This is how COVID can easily spread. All right, guys, should we eat?
Yeah.
Okay. Let me pass this around.
Some colleagues and I had the chance to share some snacks with Dr. Manav Sidhu. He's the chief resident physician for emergency medicine at UCSF Fresno. Dr. Sidhu explains the coronavirus, like germs, can spread often when you don't even realize.
It could be something as simple as touching an object while sharing a meal together or just having a conversation.
We did what many do when with friends or family. We passed around foods and drinks, touched portions we didn't want, and planted our hands on hard surfaces.
Now that we've passed around our snacks, this is what else we've passed around.
With the help of a black light, Dr. Sidhu shocked us all. Germs were exposed nearly everywhere. It was proof that if you touch something after an infected COVID-19 person, then you touch your nose, mouth, or eyes, you too can get the coronavirus. So what can you do to prevent the spread?
Number one, it's definitely washing your hands as frequently as possible. The next thing is wearing a mask and wearing it appropriately. So wearing it such that it covers your nose as well as your mouth.
Health myths about masks flood the internet, with some people worried that masks will lower your oxygen levels or cause you to take in excess of CO2.
We're here today to show that that in fact is not true, and the oxygen levels stay at appropriate levels for a normal, healthy individual, as well as the CO2 levels don't rise.
Dr. Sidhu put on an experiment, applying not just one, but 7 masks, just to prove he can breathe at a normal and healthy level, even when wearing the masks for a prolonged period of time.
I'm going to put a pulse oximeter on my hand. And the other thing is I'm going to hook up a capnographer to my nose, and that will tell me the CO2 levels. The CO2 levels should be anywhere from 35 to 45, and the oxygen level should be anywhere above 92%.
You can see when Dr. Sidhu had 7 masks on, his carbon dioxide level, seen in yellow, was 38, while his oxygen level in blue was at 98%.
We're really trying to show that one mask, a cloth mask, even if you wear it all day, is not going to hurt you and is not going to cause your oxygen levels to go down or your CO2 levels to go up.
The American Lung Association says masks are designed to be breathed through, and there is no evidence that low oxygen levels occur. They add there is absolutely no scientific evidence that wearing a mask weakens the immune system. Dr. Sidhu understands masks can be a nuisance for some, but says it's a great benefit for all.
So I work 10-hour shifts, and I wear an N95 as well as a surgical mask over the N95 throughout my shift in the ER. And my numbers are exactly the same. We have to do our part to prevent the spread of COVID-19. And if that means some discomfort in wearing a mask, then so be it.